Yeah, so atrial fibrillation, first of all, I always tell patients it's a benign heart rhythm disturbance because you can have dangerous rhythms that are potentially fatal. And this doesn't fall into that category, but it is somewhat of a nuisance. And it's a non life threatening rhythm. Oftentimes, when patients have atrial fibrillation, they can feel their heart racing or sort of describe fluttering in their chest. Um, and sometimes it can cause symptoms of dizziness, lightheadedness, shortness of breath, fatigue. And so those are things that could sort of clue a patient into possibly having that diagnosis. There are other things that can sort of manifest similarly, but those would be things that patients may uh, report when they're having. As far as when to seek medical care or attention, um, it's not a very straightforward answer, particularly because, some patients, they've been sort of dealing with it for quite some time, and oftentimes they may not even be that symptomatic, so they just sort of blow it off. But usually, if somebody has profound symptoms and they feel unwell, that is always an indication to go seek medical care. And usually, if patients have profound symptoms when they're in atrial fibrillation, they're going to know something is not right. And more often than not, when patients have profound symptoms, they're going to feel their heart racing, sort of beating out of their chest. And a lot of times, patients you sort of assume the worst, especially if they've never had an episode before. They just sort of presume that that's it. This is the big one. And so that usually is sort of the indicator for patients to come in and seek medical care. There are a handful of patients are asymptomatic when they have atrial fibrillation. So sometimes those patients, if and when they are diagnosed, it's sort of an incidental diagnosis, meaning that they're at a physician's office for another reason. And then they get an EKG or they're getting their physical exam, and then the physician detects that they're in atrial fibrillation. So there are patients that have no symptoms, and in those patients, it is very difficult to really know how to, how to sort of at least screen individuals to determine. So usually what we recommend is just making sure that you have good follow-up with the primary care physician, and then hope that if you do develop it and you are asymptomatic, that they'll pick it up, hopefully in time for it to be addressed so we can avoid potential adverse health. Yeah, so there are a number of ways that we can treat atrial fibrillation, but we can use medications to help keep patients in rhythm. And there are procedures called ablations, which are invasive procedures where we insert catheters actually into the heart, and we target certain areas of the heart that are responsible for causing atrial fibrillation. So those are sort of the two mainstays of treatment when it comes to atrial fibrillation. And apart from that, we oftentimes also have to use blood thinners to treat atrial fibrillation, because atrial fibrillation, it's not completely benign. It can increase an individual's risk of having strokes, particularly because they can form clots in the heart.